Let's get started. Welcome everyone to Good Bones, Building a Healthy Skeletal System. My name is Claudia Zerlini and I'm a Senior Coordinator with the Public and Patient Education Department at Hospital for Special Surgery. We host a variety of programs like the webinar you're attending today, in addition to our virtual classes and workshops. Today we have joining us Deborah McInerney, who is a clinical nutritionist at HSS, and Jae Eun Yoo, who's a nurse practitioner here at HSS as well. We're so glad to have you here. Thank you for joining us.
Thank you. My pleasure.
Great. So I'd like to just start out real general. When we think about bone health, why should we be concerned about our bone health?
So bones are really important because obviously it's our skeletal system, but poor bone health can really lead to fractures, and fractures can really affect your life overall and your quality of life. And so it can lead to decreased mobility, pain, sometimes depression because of the loss of the quality of life, hospitalizations, if you need any sort of surgical intervention, even for any of those fractures. So that's why I've been focused for 18 years about bone health. So yeah.
Wow. Yeah. So I've been working in trauma orthopedic service and metabolic bone disease at HSS since 2018 with Dr. Joseph Lane. So I've been learning that, especially like a hip fracture patient, when you have a hip fracture, there is a mortality up to 20% within a year. Also, even within few years, some people cannot get out of bed anymore. Their life quality is so poor. So Dr. Lane, I think it is really important to prevent the big fractures rather than just, curing their issues after it happens.
Absolutely. And I think we're going to talk a little bit about prevention later on. So when we think about low bone density, what are the greatest risk factors and who is at risk for poor bone health?
I can picture a person, a postmenopausal woman, more than 50 usually years old, with a thin, skinny, or low BMI, body mass index. Maybe Deb can explain more. Also, if your mother had osteoporosis or fractures, then I can get easily. If you are a heavy smoker or heavy drinker, could be a high risk factor.
How about, I was going to ask if there are any medications that could potentially increase your risk.
Yes, we do see a lot of patients who have been using the steroid because of their medical condition. They have a high risk for the osteoporosis also.
The other thing too is, even though you might have a genetic predisposition, you might be female, you might be postmenopausal, kind of as you lead up to that, if you think about, so what we consider peak bone mass age, meaning the age at which you can take in and build the best, strongest bone, is around 30, 35. So going back before that, when I see kids, one of the questions I always ask is, do you drink milk? Because one of the things, I am Asian. If you come from Asia, Africa, almost anywhere other than the United States, people didn't drink milk or weren't so focused on being made to drink milk as a kid. So if you're not drinking milk, you're not getting, it's the best sort of dietary source of calcium. So if you've not laid down the groundwork, calcium is the largest mineral in the body. So if you've not really been laying down that groundwork, the other thing is for bone density, weight-bearing activity. So if you are a very sedentary person for whatever reason, whether it's from pain or, bed rest, from whatever it may be. The other thing is tobacco. Tobacco use is a huge risk factor for bad bone health because you can really leach bone if you're an excessive smoker or using chewing tobacco. And so the other little sidebar is sometimes an excessive amount of alcohol consumption can also be associated with poor bone health, mostly for people that are more really alcoholic, because if people are drinking too much alcohol, they're probably not focused on getting all the good nutrients that you need just for general health, let alone bone health. So it's really broad spectrum, the risks.
Absolutely. And Deb, you mentioned leaching bone. Can you describe that a little bit and what that means?
So leaching bone is kind of what it's so if you have, so calcium being the largest mineral in the body, and if you were trying to build the best, strongest bone up until about 30, 35, there are things that can cause a whole number of things that can actually cause you to leach bone or lose bone mineralization. So if you're whole, if, we try to, get kids and young adults to really sort of build the best, strongest bone matrix so that your bones, look like if you had an x-ray, sort of like this nice webby mixture. And people that leach bone or have bone loss over time, it looks more sparse and like a little bit more Swiss cheesy than we want it to look. So that's what leaching kind of means. Yeah.
Even though we love Swiss cheese.
Right. Yeah. And it's lactose free, basically. So.
So how common is osteoporosis and osteopenia? And maybe Jae, if you could speak to the differences a little bit, that would be great.
The differences between osteoporosis and osteopenia, we can define by looking at the bone density test. Looking at the numbers, we call T-score. If the T-score is less than minus 2.5, then we define as osteoporosis. If the T-score is between minus 2.5 and minus 1.0, we call osteopenia, which is borderline osteoporosis on the way to the kind of process to the osteoporosis. I have just recent data said 10 million American people have osteoporosis more than 50 years old. I think 50% of postmenopausal women have osteoporosis. Surprisingly, 20% of male have osteoporosis. Maybe Deb has more detailed numbers.
Well, no, from the National Osteoporosis Foundation, they estimate that over 50 million Americans have osteoporosis. Wow. So it might not be resulting in a lot of hip fractures, but it might be a wrist fracture, a rib fracture, a clavicle fracture, fractures that might not happen with, if you had better bone quality, but are happening if you slip and fall and, try to break your fall with your wrist, and that's a very common osteoporotic fracture. So
are there common warning signs of osteoporosis, or do I have to wait until I get a fracture to know that I have osteoporosis?
The most common sign for the osteoporosis, we just mentioned fractures. Then you definitely need to investigate why you get fracture, even though it's not a major fractures, even though it's wrist fracture. Oh, I just had a big accident. I don't think I have osteoporosis. That's not a good explanation. You have to check it out. Also, if you shrink more than 2 inches within a year, like a loss of height, that's like a big sign for possible osteoporosis. It's really silent disease, so you cannot tell until you have those kind of changes.
Yeah.
Would there be any reason perhaps that someone would seek out an osteoporosis diagnosis without a fracture or without the risk factors?
Could be, yes. So we usually recommend if you have menopause, then it's we do the mammogram for the regular checkup after a certain age. We should do the bone density as a baseline when you have a menopause, because you do not have any protection for your bone health. When you do have a menopause, there's no hormone to protect. You just start to lose the bone dramatically. So you definitely have to check it out.
Right. Right.
And is it only one type of bone density scan that can diagnose osteoporosis, or are there different kinds of tests?
The bone density test is just, I can say, one kind, but they have different machines from different manufacturers. So when you repeat the bone density, it is better to go back to the same machine or same place, because it's hard to compare when you change the machine in a different places. So that's I can recommend.
That's a really good tip, actually. And
it's like using the same scale. You always want to use the same scale, not different scales.
Right.
Or no scale at all.
Right, exactly.
So now I'd like to talk about a little bit about exercise, because we know how important this is in promoting bone health. So what kind of exercises should we be doing to build the best bones that we can?
We usually recommend like a weight-bearing exercise, the best exercise for the osteoporosis, like walking, jogging, little bit of weight bearing with like dancing. But the most important thing is you have to enjoy the exercise, and you can continue as a lifestyle every day. But you should avoid like very impact exercise all of a sudden. Oh, I took this course today, I have to start exercise tomorrow. All of a sudden you run like 20 miles a day, you might be injuring yourself. So you have to be really start exercise like gradually, slowly, watching out yourself to prevent another fractures.
Right, like one of the surgeons that I work with at one of the clinics here, she says, you don't start exercising to get into shape. You have to do things. You can't just go out of the gate, you know, like you're a racehorse, but it is full body. I think people think weight bearing and walking. I mean, people have heard this for decades. Walking is one of the best, you know, activities. I like to say activities just because exercise, the minute you almost say it, people are like, ugh, exercise, you know, like I have to go to a gym, or, well, if anyone's able to go to a gym now. But, you know, you can just get outside, walk anywhere, walk inside your house if it's inclement weather. It's one of the easiest things. And the low impact for a lot of people that I see with severe osteoporosis should be things like more elliptical or low impact if you're walking on a treadmill, because then there are bars if you lose your balance to hold on to, as opposed to being outside. So like a stair or a stepper machine, that's another, you know, low impact one. But it is, you know, if people have balance issues, Tai Chi is a great activity, you know, really to help with balance. And, you know, even yard work for those of you who live in, you know, an area that you have a yard, you know, some heavy yard work and lifting, that sort of stuff, it sort of is helpful for bones, but it's helpful for the muscles that are really surrounding and protecting your bones. So it's not just the activity, it's sort of the activity, but the type of activity or activities really that you're participating in.
Absolutely. Now it's a great time to rake leaves. So
yeah.
Really good activity. Are there any activities people with low bone density or osteoporosis should avoid?
We usually recommend, I mean, depends on the bone density numbers or the location of the low bone density. For example, if a patient has a really low bone density in the spine with other back issue, we do not recommend any severe flexion or like a rotation of the back, you know, kind of like a golfing is not a good option for the population.
Right.
The certain position from the yoga class, not a good idea. So we have to treat individually different way based on their test results and their clinical data.
Right, because severe, you want to avoid the most risky, and that would be like bending, twisting, jumping. So whether it's running or jumping rope, a lot of people jump rope. And if you have severe osteoporosis, that's definitely something you want to avoid.
So that would also be a good time to maybe follow up with a physical therapist or an exercise physiologist, someone who can help you through it.
For safe activities. Yeah.
Also being careful in like classes like yoga or Pilates and really know what you can and can't do.
Yes.
Absolutely. So we talked a little bit about exercise, and now Deb, I'd love to dive into your expertise here on healthy diets to promote bone health. So what kind of foods have what kind of vitamins and minerals do I need to build healthy bones, and how can I get there?
So I think that, I know, Claudia, you know this because we've done this, a bunch of times, but you need every nutrient. There is not a nutrient on the planet that is in our food that you don't need. So I think over the years, people have, really kind of focused on, and I even see it in when I see outpatients, people come in and they have lost the diet variety because they know calcium is important and they know vitamin D is important, and they're having dairy 3 times a day but like no vegetables because it doesn't really fit in with eating yogurt or having cereal or milk and whatever. So any sort of, no matter the condition, no matter the nutrients that you might make sure you want to get enough of, you still need to roughly eat from all the food groups if you can tolerate it: your fruits, your vegetables, your grains, your proteins, whether it's meat, fish, chicken, then there's beans, the legumes, beans, nuts, that sort of thing. Dairy plays a huge role. So really it's no longer food guide pyramid. I can't believe I was going to say that. It's like a clock plate. And basically the plate it has a room for, ideally, a meal should have a protein, vegetable, a complex carbohydrate, like a grain, and then have like a little side of dairy, and you might have a fruit. No one is eating that way realistically. I get that. So you really want to just try to do your best. Unfortunately, your calcium, the highest naturally rich calcium foods are your dairy foods. So I've been accused over the years of being a dairy pusher, and I'm like, I am no way saying that you need to. I am telling you the foods that have the most, but now so many people are using these cow's milk alternatives. And so some of the brands are really what I consider hyper fortified because they have 50% more calcium per serving than cow's milk has. So you want to just try to be a smart consumer. And if you're not really already aware of everything you're putting in your body, you might want to start reading food labels. The food labels are based on, it's like my biggest thing in terms of calcium, because the food label, it's a USDA mandate that it has calcium in a percentage. The percentage on the food label is based on 1,000 milligrams. So if it says, so milk would be, no matter the type of milk, if it's skim, 1%, 2%, or whole, it'll say 30%, which means 300 milligrams. It's sort of lazy math. You can put a 0 where their percentage sign is. And a lot of people, if you kind of do a little bit of a food diary or kind of keep track for a few days, sort of how you're eating, what you're consuming, to see sort of how well balanced your diet is. Because any diet, you might have a diet very rich in calcium, but it doesn't necessarily, it's not going to improve your bone health. That I want to be clear on, because a lot of people that I see will say, I want to increase my calcium intake to improve my bone density. And I'm like, it doesn't work that way. You need that amount to help prevent further loss. Then there's the whole part of, the medication role. But the calcium specifically, the needs are based on ages, gender, and for women, sort of life cycle, where you are. Prepartum, postpartum, premenopausal, postmenopausal. For men, it's a little different, but we know based on sort of where you are in life, how much calcium is recommended. And then if you have a fracture, your needs go up a little bit after to, hopefully remineralize that bone. Vitamin D works very differently. And vitamin D is one of the other things that I would say 5 years ago kind of came out as the nutrient that everyone focused on. And then everyone forgot about calcium. And so some doctors included that I've seen. And I'm like, no, you need both of them. So vitamin D is different because it is a fat-soluble vitamin, and a lot of people remember that you will hold on to it, unlike vitamin C or B, that you don't want to take too much, but we don't really see vitamin toxicity in vitamin D because most people are deficient. And so even though it is the sunshine vitamin, most people are not, especially during COVID, most people weren't outside so much or are outside during summer warm months to get enough vitamin D from sun exposure, because most people don't want skin cancer and put on SPF. So if you're wearing sunblock, it's blocking usually like minimum about 90 to 94% of those UV rays that would synthesize the cholesterol in your skin to make vitamin D. So a lot of people that get lab work done, if you get your vitamin D level checked, we sort of know what to give you based on how much your blood level is. So a normal range is 30 to 80 or 30 to 100, depending on the lab. And a lot of doctors are like, oh yeah, 30 is fine. In the bone, if you have a bone health issue, the serum, the blood level goal is 50. Research is showing us that people with blood levels in the 40s, it's associated with better bone health, which always makes me laugh because it's the closest to 50. So, but sort of starting, and a lot of people that take a multivitamin, most of the sort of mainstream brands of multivitamins now have about 1,000 milligrams, 1,000 IUs of vitamin D. So a lot of people are getting some every day if you're taking a multi. Most of the other stuff in the multi you don't need, because if you're taking it every day, you're not really, your body isn't utilizing it because it's not deficient. But those are sort of the two major ones. There are some, vitamin C has been shown to be really important, but vitamin C to me is not worth supplementing. I know a lot of people, especially now that it's becoming cold weather and it's an antioxidant, so once COVID hit, everyone was like, oh, I'm taking my vitamin C. Vitamin C and any nutrient is going to be utilized best from food. So even though vitamin C itself is an antioxidant, there are so many antioxidants if you are eating foods naturally with color. So your broccoli, kale, everyone eats kale now, anything. So a kiwi, strawberries, those are two vitamin C rich foods. These are things that you're also getting these phytochemicals, those good colors are another antioxidant layer in something that you're consuming. And it just leads then to better diet patterns and then overall improved weight. And so it's sort of all related, but you still need adequate protein, adequate calories. You need kind of broad spectrum of all nutrients, all vitamins and minerals, but we focus on the calcium and the vitamin D to make sure, because those are two of the more prominent ones. Magnesium, phosphorus, those are, involved as well, but people are too quick to just supplement everything instead of looking at diet first and making sure you're getting a serving or two of fruit a day, a few servings of vegetables a day. An easy rule of thumb for good diet quality is try to get vegetables. If we're talking about a breakfast, lunch, dinner, try to get a fruit with breakfast, vegetables with lunch and dinner, maybe a fruit snack, just to kind of make sure that you're getting some of the regular basic nutrients you need for general health, because your bone health isn't going to be great if your general health is poor and your diet is poor. You can't, food can be our medicine, but it's no magic cure for just focusing on a few isolated nutrients. So it was a very long-winded answer to that, but it's so broad spectrum. So
no, and it's true, and it's great advice. We need to look at health and nutrition as a whole, not specifically just for our bones. Are there any foods that might be detrimental to our bone health? Perhaps like caffeine, foods with caffeine in them. Could you speak?
So, I think the rule of thumb with caffeine intake, no matter if it's coffee, tea, an energy drink, whatever it is roughly 1 or 2 a day. The problem with caffeine is when you have an excessive amount of caffeine consumption on a daily basis, it really can leach bone, kind of demineralize the good stuff that we want to keep there, mostly in the presence of inadequate bone nutrients. So if you have no dairy, for instance, you're allergic to milk and milk products, and you don't take any vitamins or supplements, and you drink 3 venti Starbucks coffees a day, you might be, having some problem with your bones. So that's not, because then there's no moderation, right? If you're having that much caffeine intake. So whether it's coffee, whether it's tea, I think you just really need to be careful. Everything in moderation. The one thing I will say about caffeine as well is there is something about a light color beverage that people don't equate with caffeine. So a lot of people drink green tea, and green tea is naturally caffeinated. So you really have to just be careful. Even though there are good antioxidants in that as well, 1 or 2 cups of caffeine a day is really the recommendation. So.
Absolutely, great. And just I wanted to go back to something you mentioned previously, Deb, about fortified foods with calcium. Can you get too much calcium? And are there, can it do damage to your body?
So it really depends on how you are made up as a person. So a lot of people will say, oh, well, if you get too much calcium, you're going to get a kidney stone. And it doesn't necessarily, depending on how your body is built, it doesn't mean that you're going to, but there's nothing proven that getting too much calcium, and by too much, I mean really anything over, I mean, the upper limit is 2,400 milligrams of calcium. Nowhere does it ever, no study has ever shown that even getting over 2,000 milligrams or even over 1,500 to 1,800 milligrams of calcium a day will improve your bone health. So I've seen some people over time that have been taking, 1,200 milligrams of calcium a day, but then they happen to be drinking like a quart of milk. So I think, well, like, it's just too much. Like more isn't better. It's sort of the American way that we think more is better. But in the case of calcium, you want to have divided doses, whether it's a natural food form or a supplement. And by supplement, I mean a pill, a chew, the liquid calcium, or the supplement that is really in these cow's milk alternatives. So all of these milk, oat, cashew, soy, rice, all of the almond milk, all of those milks have a liquid supplement. I kind of I refer to it usually as a liquid supplement because it doesn't have naturally occurring calcium. So that's why you just want to really be careful and do a little bit of a inventory of what you're consuming on a regular basis to see if you have too much, if you have too little, where you need to fill in the gaps with your diet overall, not just your calcium and vitamin D and some other nutrients. So, but yeah.
Great. So let's say we're doing everything right. We're doing the weight-bearing exercises. We're eating a calcium-rich and just generally balanced diet. But at times it seems like that's not enough. So when we talk about medications for osteoporosis, Jae, I was wondering if you could speak to that a little bit. Oop, you're muted.
You're muted, Jae.
Yeah, you just have to unmute.
Sorry.
No worries.
Yes, we can cure osteoporosis. There are two ways to treat the osteoporosis. When you have like early stage osteoporosis or osteopenia, we usually treat with the oral or IV bisphosphonates to maintain your bone and prevent worsening osteoporosis. Another way to treat the osteoporosis, especially when you have advanced osteoporosis or like a major fractures, then we can strengthen your bones with anabolic agents. I can say brand name, the Forteo, Timnos would be anabolic agent to build up the bones. There's a new medication just came out. Evenit is another anabolic agent to make the bones. Some people can reach back to the normal like at 35 years old. So if you have any treatment plan, let us know. We are ready to treat you.
That's great news. It's
Yes.
that it can be cured. That's really fantastic. And I guess I'm curious to know how much would diet and exercise balance with medication? If you take medication but you don't improve your diet quality or you don't exercise, is it going to have the same effect?
Definitely. So we do have more than 1,000 patients who are taking, for example, Prolia. So I do seeing them like every 6 months to make sure their calcium level is good, vitamin D is good, because Prolia can lower certain numbers, including calcium level. Whenever I see them, if you do have a regular exercise programs with a great diet source and listen to our instruction in terms of with a good diet and supplements, the newborn density next year is tremendously much better than who don't do those kind of exercise or like a diet course. So definitely you need to combine or process together to treat the osteoporosis.
Absolutely. So it's not that the medication is a cure-all. It needs to work
That's right.
in conjunction with a healthy lifestyle.
Yeah.
Great. So I do see that we have some questions in the Q&A that I would like to address. If anyone has any additional questions, please feel free to add them into the Q&A. Okay, so first question here, we have, I'm doing Tai Chi and walk 3 to 5 miles each day. Is this good for osteoporosis prevention?
Yes, this is perfect. So one of the tips of the exercise, if you do those kind of like a cross training, do the muscle strengthening and weight bearing exercise can affect your whole body systemically. So outcome is much better. I think she's doing perfect way. She already, yeah.
Great.
Agreed.
How much alcohol intake per week is considered dangerous to bone health?
So it's hard to know exactly without knowing diet, like what this person's usual diet is. I think anything over 1 to 2 drinks per day, which would translate to 7 to 14 drinks a week, could be seen as excessive. If, say, you have a regular healthy diet and it's pretty well balanced and you're having a glass of wine or 2 every night, it's not the worst thing. But if you're maybe a 1 meal a day person and you happen to have a few drinks, every night, then you're probably just cutting out a lot of nutrients that your body might need, let alone your bones might need. So it's hard to say, again, and based on the size of the person and lifestyle of the person, it's hard to give such a black and white answer with a number, but it's, more than a few, I would say just, for argument's sake, more than 1 or 2 a day.
Right. It's always challenging too, because we get other information that, alcohol can be good for, like red wine could be potentially good for your heart health or something. So you don't always
a glass a day.
1 glass.
A serving a day. Yes.
1 serving.
Yes. Yeah.
Okay. So we had a question about milk as not a great form of calcium because of studies that show that dairy cause inflammation. Deb, do you think you could speak to that a bit?
This is this question is always, so dairy, it really just depends. It's not so much, there are things over the years, I've done so many talks about inflammation and the anti-inflammatory diet. Depending on having a glass of milk a day is not going to make you pro-inflammatory. It really depends on, that's why you have all of these other nutrients in your body. If you were drinking only milk and you were sensitive to milk, where you were having some sort of reaction that you were getting inflammation, then yes, you probably shouldn't be drinking milk. But having things in moderation, you have some milk, you might have a yogurt, even if you're having some cheese, it's not necessarily that cut and dry, because I've heard this so much over the past couple of years, especially. And I always say, I'm totally fine with people trying and doing anything. And I always say, if you cut out dairy and you feel better, then it's probably working for you. And that's fine. But then you may have to make sure you're getting those nutrients that your diet is now void of or devoid of some other way. So that's fine. People don't want to consume dairy. They totally don't have to, but they have to look to where they're going to get those nutrients then.
Absolutely. I know we talked about this a little bit, but is there a gold standard for bone density tests right now? Is there a test better than DEXA?
So yeah, DEXA is a dual energy X-ray. That's the gold standard for the diagnosing the osteoporosis. However, HSS has QCT. We do the CT scan of usually spine, select a certain levels to measure the bone density through the CT scan, which is more accurate. But we usually use those QCT for the patient who are not able to the regular bone density because the patient already had 2 hips are already replaced. We usually check the bone density in the both hips, so we cannot do it. or the patient went through the big like a spinal surgery, so we cannot measure whole spine. So we have to pick certain level to measure those area to make sure the patient does not have osteoporosis. That's the second option I can tell, but definitely gold standard is a bone density, yes.
Great. A question, are there racial differences in bone architecture, and do they impact appropriate interpretation of bone density test results? For example, studies show Japanese women are at less risk for fracture even when their bone density scores are low because their architecture is stronger.
That's a good question. So unfortunately, bone density can show only depth. They cannot show like a structure and other bone issue, especially when you have another disease, could be different. So we can define if you do have a normal bone density, but you keep breaking the bone, there's something's going on, we might have to check other ways with a multiple test or bone biopsy can tell us how your structure looks like. Also, I just mentioned that QCT can tell a little bit better than bone density, yes.
Now this one's for you. Do you need vitamin K with vitamin D?
You don't need to take vitamin K with D. I get weary of people. I've just noticed recently a few people that I've seen have been taking vitamin K. You just have to be careful. People have to be careful because for a few reasons. One, it is fat soluble, so it's not a regular blood level that any prescriber or clinician I know is checking. So if you're just sort of self-medicating with vitamin K, it's not necessarily going to be helpful and it could be dangerous. The other thing is vitamin K is crucial in blood clotting. And so if anybody is on a blood thinner, but most specifically Coumadin is the one that really interferes with clotting, and vitamin K, the INR levels, the blood clotting levels, every, you know, depending if how often people are having it checked, it's just a really makes me nervous that people are just taking it, you know, regularly. There might be some, you know, there's definitely a trace amount in most of the multivitamins, but you just to take a separate vitamin K, not one person on this or ever anywhere should be just starting to supplement, self-medicate without checking with their doctor. And if anyone goes to different pharmacies, because I know a lot of people, they might get pharmacies filled through the mail, but then they might run to CVS or Walgreens or whatever, or a local neighborhood to pick up something. So there's no central place where anyone is tracking all of this. So you really want to be careful with just taking supplements. And also that none of the supplements are regulated by the FDA. So you really want to make sure what you're taking is a somewhat reputable brand, one of the brands that's been around for a while. If you can't find any information, you know, except from the company that sells the vitamins, probably not a good one to take. So
That's good advice. And also that would be a good opportunity for you to bring a list perhaps of supplements to your physician or to your clinician.
Always, always, yes.
Okay, we have a few questions, Jae, about the new medication for osteoporosis that you mentioned.
Oh, the Evenity. E as a Edward, V as a Victor, E as a Edward, NITY.
Divinity. Okay, great. So everyone who asked that, it's
Okay.
Divinity. Thank you. And was that that was the new medication that you referenced could rebuild bone to age 35?
Yeah, I mean the same. I mean similar, working in a different way, but yes. Forteo, Timnos, and Evenity, 3 medication make your bone density like a almost like a reach it to normal range, less than 1.5. Yes, and the Prolia is another good drug. I think there is a question about other medication for the prevent osteoporosis, not the anabolic agent. Mm-hmm. So the initial treatment for the osteoporosis and osteopenia, as I mentioned, the bisphosphonate. The brand name should be Fosmex, Actinol, Atevia will be the oral medication choice. If you have an issue with the GI system, we usually give IV instead. That would be reclassed, and Aredia would be the option for the treatment.
Reclass, like osteoclast?
Yes, reclassed.
Okay, how much calcium you're taking is reduced when taking a PPI?
So for those of you that are taking PPIs, you know, if it's an over-the-counter, this is something you definitely want to speak to your doctor about, because most people shouldn't be on a PPI kind of forever. So it is decreasing the acidity. Calcium in itself really likes an acidic environment for absorption. So calcium carbonate, one of the most common supplemental forms, really the recommendation is to take it with food so it stays in your stomach longer. If you're taking a PPI, I would just not try to have if you take it in the morning, maybe don't take, you know, have your calcium, whether it's a supplement or from food, at the same time, you know, or the other part of that is, I understand people are taking PPIs for different reasons, whether it's like Barrett's esophagus, reflux, whatever. If it's an acute issue or if it's a long-term chronic issue, is really maybe try to look to the things that are, whether it's diet, lifestyle, things that are causing or adding to the reflux. Because I mean, during the past couple of months, I know so many people that have never had reflux and have had it just because the increase in anxiety or stress in their life. But if it's more diet related, it can be weight related, it can be time of day you're eating, it can be, you know, it can be a whole number of things. And so we sometimes try to treat the reflux without, to limit or decrease the length someone is on that medication, because it can have a negative effect on bone quality. So
that's great. Is there any research on the effects of taking vitamin K2 or eating fermented foods?
So K2, no. Not current studies, unless Jae Eun knows something differently in terms of K2 for bone health specifically. Fermented foods are, so I would say over the past couple of years, the gut biome has become the newest hot topic. And so I know, Claudia, I think, didn't you do a webinar or something recently about this? So it's sort of found to be really an integral part of like every system in our body and every, you know, form of health, whether it's bone health, gut health, mental health, physical health, cardiovascular health. So I think there's nothing specific in terms of probiotics and bone health. However, if you're getting a probiotic-y type food, like kefir, like yogurt, it sort of is a dual purpose. I like to kill, I was going to say, it's probably not PC anymore to say kill two birds with one stone. But if you have dairy, you have some protein, you have some calcium in there. So for those of you that do kefir and you like it and you will, you know, drink it every day or use it in your diet every day, or yogurt, it really is giving you good bacteria, which helps populate the good bacteria in your gut. And then also it'll give you some natural calcium and some protein. It's sort of like a 3-in-1. It's like a perfect, it kind of ticks all these boxes. So it's not that it's crucial to it, but it's certainly an important part of just general health. And fermented foods, whether it's kimchi, whether it's sauerkrauts, things like that, they have this, you know, good probiotics, which are good for your gut health, which can then in turn, I always imagine, you know, it positively affects, you know, the other parts of your health and body in general. So
that's right. So there is a recent study. It's not human. They did a fecal transplant to the different rats with a healthy, normal, with a lot of, you know, good germs there. The other one is not. They showed the differences between two rats in terms of their bone health and structures. So we don't have evidence with a human yet, but I definitely recommend taking those, you know, good gut health supplements. There's no harm. Eating yogurt like kimchi, yes, I think is a great option to improve your bone health.
This is an interesting question. Does osteoporosis always need to be treated?
I'm sorry, question?
Does osteoporosis always need to be treated?
Always. I should say yes, as orthopedic healthcare providers. Again, in order to prevent the fractures, your life will be totally different. It's like a same concept. When you do have a hypertension, you need to control that before you have a heart attack or a stroke. It's like a silent disease. You don't feel anything. However, it can come back with a big trauma in your life. So I would say yes.
Yeah.
Great insight.
Yeah.
Yeah. You would agree.
Well, yeah. I mean, I was just thinking the number of patients that I've seen over the years with fractures, whether they were related to osteoporosis or sometimes found out that they had osteoporosis from having had a fracture. And so, you know, a lot of people, there was a young 40-something-year-old who had a freak accident, but they would have never ever guessed a 45-year-old male would have osteoporosis. And when I went to see him, because the surgeon happened to see me in the hallway, this was like 15 years ago, he said, "Can you please see him? This guy's bones were so soft. We could take out hardware. They were taking out screws with their hands. They didn't need tools." And I was like, what? So I went to see him. He had been a smoker for like it was like 30 years. He started smoking when he was 15 years old. His bones were so soft. And I thought, wow, I can't believe I'm saying this, but it's kind of good that you had this accident, because you never would have known otherwise. And you cannot smoke anymore. He was like, okay, you know, but yeah, it can be really depleting and really devastating and really changing your life for the worse. So.
Absolutely.
Yeah.
What kind of doctor would you see to go get a bone scan?
What kind of doctor?
Yeah, where should you start if you're concerned about your...
I mean, in order to test the bone density, especially when you're menopause, you can discuss with your GYN doctor, primary doctor. Also, we do have a lot of metabolic bone service specialists, including endocrinologists, orthopedics. Everybody is open to help you guys.
Someone mentioned they recently started taking Tymlos daily injection. When should you get tested again to see if it's working?
I usually follow up the Tymlos patient. After we start the Tymlos medication can change your electrolytes balance. So I do checking labs within 2 months to adjust the calcium and vitamin D level. After that, everything is stable. Usually most people are good to go for up to 1 year. Even though NOF recommends bone density every 2 years, I would double check another bone density yearly to make sure those medication, can help the patients to checking out. So I would suggest you have to check yearly to make the further decision that you need to take another second year for the Tymlos.
And while we're talking about medications, are there any side effects to these medications that people should be aware of?
Yes, each medication has different side effects. So it's gonna be I need long time to discuss each, but definitely when you start the medication, you have to check with your providers very closely in terms of the labs. You cannot just stop the medication out of a sudden own way. For example, like Prolia, during the COVID, a lot of patients just stop it because they don't want to come to the hospital. They don't want to do it. Then they came back with other complications, which is not good. So you have to really maintain a close relationship with your providers to avoid those side effects. When you start each medication, the provider should go over the details, possible complications. But it's a lot of information and each medication is so different. So I don't think we have enough time to go over that now.
Absolutely, but definitely keep an open conversation with your provider.
Yeah.
Don't stop any medications that you've been prescribed.
Right.
To your provider. Okay, let's see what else we have here. Are there any alternative care treatments that help with bone density? For example, acupuncture, massage, meditation, perhaps?
I mean, there are a lot of alternative treatment option I heard, but nothing is like strongly evidence by. Like for example, like, oh, I do have like some vibration treatment. I mean, they're doing study, but we've never seen strong evidence, so we cannot recommend as a healthcare provider. But if you think it's not harmful, you may try. But again, it's hard to get better when you have a severe osteoporosis. You need to evaluate and treat yourself with a healthcare provider immediately.
Deb, this one's for you, and we've talked about foods a lot, but could you name a few of your top calcium, high quality foods? I didn't hear beans yet today, so.
So I think that for the most part, the ones are, if anyone out there can tolerate dairy, and by dairy I mean milk, cheese, yogurt, kefir, even if it's like a drinkable, or if you do a smoothie, those are pretty much the best bang for your buck. I used to anecdotally say, or I still anecdotally say that people that don't drink milk have no chance of getting really enough calcium in their diet. I stand by it for this reason, because if you think about like your teenage boys, they drink, like a lot of them drink so much calcium, and anyone on this who's participating that has a son that and knows like they might drink a half a gallon of milk a day, they have the best, they're going to have a really good bone density kind of going into adulthood. For those of us, and by the time, and most people do phase out of it, I think that in the 80s with the soft, and this has actually been proven, but in the 80s with the soft drink boom and with all these energy drinks, a lot of kids no longer are drinking milk. It's just not really an accepted thing to drink, and it's not, but if anything, it has some sort of protein in there. So when kids, a lot of times will say to me, well, I drink chocolate milk, and our biggest dilemma has always been, well, at least they're getting milk. I mean, most kids aren't drinking gallons of chocolate milk every day, but if it's what gets them to drink milk, it's a low-fat milk. So even if they get a little extra calories from the chocolate flavoring, so be it, because they're at least getting that. If you can't really tolerate dairy and you're already using some of these milk alternatives, then you can certainly use any of those. But just know it's a liquid calcium supplement basically added to the milk. So, but for the most part, that Greek yogurt boom, I mean, whoever thought 10 years ago it would be what it is now? There are so many different types of strained yogurts, whether it's Icelandic yogurts, there's one Quark from Germany, the Greek yogurt, any of those strained yogurts have more protein per serving. And naturally, the way they are made, it is really skimmed of a lot of carbohydrates. So the natural carbohydrate level is a single digit. It might be 4 or 5 grams per serving, but where the rest of the carbohydrates start coming in is just the flavoring. So a lot of people that are lactose intolerant can really tolerate those Greek yogurts because they don't have a lot of lactose in them. The other thing too is if you're, other than milk or yogurt, if you do eat some cheese and you don't have an issue with cholesterol, adding a slice of cheese or having a cheese snack, whether it's the individually wrapped like mozzarella string cheese, which has usually 100, 150 milligrams per piece, or the little individually wrapped like Gouda cheese, the Baby Bell in the wax has 200 milligrams of calcium. That's like a 50, 60, 70 calorie little snack. You can grab 2 of those and you have 400 milligrams of calcium. It's like, a great amount to have. So just little ways like that, but the cheese, milk, yogurt are the best sort of bang for your buck in terms of natural sources of calcium in food.
Thanks. We have a couple minutes for a couple more questions. I have repeated bone density tests at the same facility for years, and findings have improved from osteopenia to normal, but I'm not doing anything different or new.
Wow.
Any thoughts on this?
It's really rare to see get improved from osteopenia to normal. Maybe she's the one, our role model who does exercise every day, eating healthy food, and taking supplement like Deb says. Probably she does that way. Maybe she can teach us any tips where to see that.
Absolutely. Bring her on the webinar. What causes a decrease in bone density post-menopause? I guess this person's questioning what the mechanics of it are.
So when you have a menopause, you do not have enough estrogen who's been protecting your bone resorption, so losing the bone process. So it kind of aging process. When you get the menopause, you're gonna feel, oh, everything is different, everything is achy, you get more wrinkles, all of a sudden your blood pressure goes high, everywhere it's gonna problematic, including start to lose the bone dramatically. This is all estrogen issue. So when you have a perimenopausal period, it's a good time to discuss with your GYN doctor about maybe I need some hormone replacement therapy. That one is another good option for the perimenopausal women who don't have osteoporosis yet, but we can delay that process and prevent osteoporosis further down if you are open to the HRT, hormone replacement therapy. So estrogen is the key.
Great. And someone had asked about HRT as well, so thank you for addressing that. And last one, let's see. Deb, one more for you. Your favorite vegan calcium options.
Oh, from food, I guess it's any of those cow's milk replacements. They all are anywhere from 350 to 450 milligrams of calcium per 8 ounces. So that's a good way. A lot of people are doing overnight oats or making smoothies and using almond milk or any of those milk alternatives. Just make sure, usually the ones that are in the refrigerated section have a little bit more than the shelf stable ones. So, but they do have a long shelf life even after you've opened them because they're really so low in protein. So that's the only thing is you're really losing protein from it, but you want to just make sure that you're getting, sort of those protein sources from legumes then as a vegan. But that is really the best bang for the buck for vegans.
Great. Well, thank you both. We're at time. Thank you all for joining us today. Thank you, Jae and Deborah, for joining us and sharing this wonderful information. This webinar will be recorded and posted on our YouTube page, and I will share that in a follow-up email. If you'd like to learn more about our programs or about the care that we offer at HSS, please feel free to visit us at hss.edu. Have a great day.
All right. Thank you all.